I'm Tim Schroeder, and I am the CEO and founder of CTI Clinical Trial and Consulting Services. I am actually a graduate of Xavier University for my undergraduate studies, and did graduate work at the University of Cincinnati, and have a background in healthcare and life sciences as well as business. The location we're sitting in today is our corporate headquarters here in Cincinnati, Ohio. We are a company that is hired by the pharmaceutical and the biotechnology industry to run their research studies to get their drugs approved by organizations like the FDA. We're a 13-year-old privately owned corporation. I think, my parents and my grandparents, really were that generation's version of the American dream. My father, his father actually passed away at a very young age, and so he actually put himself through school and also assisted in putting his siblings through school. My mother was part of a family. My grandfather was a very successful businessman, and my mother was, very active from as long as I can remember, doing a lot of charity work, always helping to this, even to this day. I'm fortunate my parents are both still alive. They are very active grandparents, and on my wife's side, her mother's still alive. So, I sort of feel like, we kind of relived the version of the American dream that, that I had when I was a child. I actually was part of teams that really developed life-saving therapies, which, I think, sort of embodies, the American dream. Many of these developments would not be possible today if not for, the hard work, the creativity, the, can do, nothing stops us kind of attitude that I was able to be a small part of a large team that did that. I get to live the American dream, kind of the 2012 version, as I would, consider it. It's probably pretty different from maybe the 1950s or 1960s version, but I think the hard work, the passion, the persistence that were necessary to be successful then are the same things that, make you successful today. I think in my regard, I had huge advantages that many others didn't have. And, I think, for instance, my parents chose to send me to a Jesuit high school. I ultimately went to a Jesuit university. I think those kind of things really are critical. The formative years, I've seen those sayings, you probably have too, about, the important things you learn in kindergarten are the things that, form you for the rest of your life, and I think there's a lot of truth to, the things you do, the things you're exposed to, the things you learn as a youth, are really the things that, carry forward many, many years later. And a lot of people say, about our business that, we run the business like a family, and I just think that's kind of the natural thing to do, and you tend to read and hear a lot in the media about, greedy corporations, and I think there may be some truth to that in a very, very small minority of examples, but I think most, people in most groups that we come in contact with on a day-to-day basis aren't like that at all. I do. I was actually at a birthday party for my mother-in-law this past weekend, 80-year-old, birthday party, just, by chance. But one of the individuals that was there, who was very, very close friend of hers, received a heart transplant more than 15 years ago. And this gentleman is similar age to my mother-in-law and to my parents. And he clearly is an example, I think, of somebody who, if the medical technology and breakthroughs hadn't been there in the 1980s and 1990s, he wouldn't be here today. When our kids, get to be adults, they're not going to be doing heart transplants or liver transplants or kidney transplants. In fact, for many diseases, you're going to just receive some type of what we call regenerative medicine type approach, where patients get cell therapy. So right now we're doing studies, for instance, when somebody's liver fails, or their heart fails, or their kidney fails, you actually treat them with some specific cells, and that repairs the damage. And I really think that, that type of approach 10 or 15 years from now is going to be the standard. And so I think to your long-winded answer to your question, but I think, you know, if you look at the dream, I think this type of an approach is going to allow people to live, you know, the dream for a much longer period of time, hopefully in better health. I think, you know, to give you an example, when I first was involved, when I first got out of school, you know, organ transplantation was very, very investigational. Now it's, you know, a standard of choice, standard of care. You know, it's rare that you go to a company, that you go to a school or a church, that there's not some recipients, you know, that have been maybe 10, 20, even 30 years with their life-saving organs. So I think the other part of it is you make a gift, you know, of an organ of a loved one, but then you're actually able to see sometimes for decades, maybe even longer, the results of your gift, which I think, you know, that actually even brings that community full circle, I think. So it's a pretty unique situation. You know, we have you know, sayings around here, you know, about lots of things, and you know, for me, it's always, you know, number one is passion. If you're not passionate about whatever that dream is, it's not going to happen. The second is persistence. You know, you really have to be persistent, you know, about it. The days of overnight success, you know, I guess there still is in reality TV and, you know, a few things like that. But I think for the rest of us, you know, it's all about, you know, a lot of hard work for a long period of time to get it. And then, you know, I think you got to keep in mind the purpose, you know, behind it. You know, I find that the people that I like to emulate, the people that I, you know, find that are the most successful, aren't the people that are doing to say, I want to make a lot of money, I want to be really famous. It's usually people that are saying, I want to do the right thing, and I want to do it for the right reason. So we always put the purpose, you know, in there with the passion and the persistence. And then the last part of it is the patience aspect. You know, it kind of seems counterintuitive when you say you got to be persistent, but you have to be patient. But, you know, it's one of the things when I talk to my children frequently, it's about, you know, God gave you a long time on the face of the earth. Don't take it for granted, but on the other hand, don't expect something to happen, you know, immediately because you want to, and don't be afraid to fail, because, you know, probably our best things that we learn, you know, are through the mistakes and the failures that we have.